Good morning, class. Today we move from the theoretical aspects of risk management to one of its most critical operational elements, disaster communication. Think of it as the central nervous system of any emergency response. Without effective communication, even the best planned disaster response can falter. Our discussion will cover why communication matters, how public health agencies implement it, and the practical strategies used during emergencies. Disaster communication is not just an auxiliary function. It is central to saving lives and maintaining social stability. Consider a sudden volcanic eruption in a remote town. Timely alerts about ashfall zones and evacuation routes can prevent injuries and save lives. 4 reasons communication is vital. Timely dissemination. Providing immediate, fact-based instructions, such as shelter locations during a flood or chemical spill. Mitigating disorder. Accurate communication reduces panic and limiting chaos and misinformation. Fostering resilience. Even if responders are delayed, well-informed communities can take protective actions themselves. Preserving social capital. Reliable communication combats rumors, sustaining public trust in authorities. Public health agencies play a unique and pivotal role in emergencies. Their responsibility extends beyond medical care. They translate scientific data into actionable guidance for the public and coordinate efforts with government and private sector partners. At the heart of this is a structured communication mandate, which ensures communities understand risks and respond appropriately. To operationalize this mandate, public health agencies focus on 6 key responsibilities. System activation. Quickly set up communication channels when a crisis hits. Assessment and monitoring. Continuously track emerging health risks, like disease outbreaks post-hurricane. Defining guidance. Provide clear, actionable instructions. For instance, boil water before use during a contamination event. Building consensus. Align scientific and medical recommendations across agencies to avoid conflicting advice. Capacity building. Maintain long-term resources to support effective communication beyond the immediate crisis. Community engagement. Cultivate trust to ensure public compliance and cooperation. Understanding how people perceive risk is crucial for effective messaging. We address 4 dimensions. Risk. What is the threat? Example, a rapidly spreading wildfire. Exposure. How does it affect me personally? Mitigation. What steps can I take to reduce danger? Behavioral change. What specific actions must I perform? Key principles include voluntary versus involuntary risk, natural versus human-made hazards, and known versus uncertain risks. For instance, people often overestimate plane crash risks, but underestimate flood risks, which can influence compliance with evacuation orders. A message is only effective if it resonates with the audience. Going beyond demographics, you must understand cultural norms, past experiences with disasters, and local values. For instance, evacuation messaging in a rural farming community may need to address livestock safety, not just human safety. Tailor messages to available resources, literacy levels, and preferred communication channels. This is about meeting people where they are. Disaster environments are inherently complex. Stress and anxiety, high fear levels impair comprehension. Media sensationalism. Exaggerated reporting can spread misinformation. Complex data. Scientific or technical information must be simplified quickly without losing accuracy. Imagine trying to explain water contamination risks during a flood while the public is panicking. Clarity and speed are essential. Communication happens on 2 fronts. Internal communication. Ensure all staff provide consistent information. Use cascade systems and regular drills. Offer stress reduction support for responders who face high emotional strain. External communication. Engage media, local stakeholders, and the general public. Partner with trusted local figures like religious leaders or community organizers to enhance message credibility. Messages must be clear, simple, credible, consistent, and actionable. Spokespersons should be trained in media engagement, situationally aware and able to proactively address rumors, trusted and authoritative to ensure public confidence. Example, a mayor trained in media response delivering updates during an urban flood can significantly improve compliance with evacuation orders. Collaboration is essential for coordinated action. Regular executive briefings ensure decision makers are updated. Resource reassessment and safety checks prevent operational lapses. Engage elected officials, community leaders, and local influencers to enhance the reach and acceptance of messages. Disasters require cross-agency coordination, such as joint evacuation planning between health departments and fire services. Warning messages should be simple, direct, and timely. Include the event type, potential risks, and safety or evacuation instructions. Verification is critical. Confirm the source, ensure accuracy, and check that the public received and acted on the information. Repetition is key. People often need multiple exposures before taking action. Communicating risks is one thing. Ensuring behavioral change is another. Common obstacles include belief-action gap. Knowledge does not always lead to action. Weak risk perception. People may underestimate personal danger. Communication fatigue. Too many alerts can cause apathy or inattention. Effective disaster communication requires diverse tools and channels. Manage aid and donations clearly to avoid chaos. Utilize interpersonal communication, broadcast media, phone networks, social media, and mobile apps. Redundancy ensures messages reach the public even if one system fails. Strong media relations are built before a disaster occurs. Encourage clear, concise, and accurate reporting. Use a Joint Information Center, JIC, to centralize and coordinate messaging across multiple agencies. Example, during a pandemic, a JIC ensures hospitals, public health agencies, and government officials release unified guidance on safety protocols. Multiple alerting mechanisms save lives. Primary systems, sirens, wireless emergency alerts, WEA, reverse 911 calls, redundancy, backup networks in case primary communication fails. Power and telecom backup, essential for hospitals and public health centers. To conclude, remember, disaster communication is the backbone of response. Timely, credible, and actionable information saves lives. Audience, environment, and channels must be carefully considered. Collaboration, verification, and redundancy are not optional, they are essential. In short, communication is not an afterthought, it is the lifeline of effective disaster management.